Well, 141 new cases of COVID-19 have been confirmed in Ghana, taking our active case count to 1,064. Now, the latest turn of events is being described by some experts as a possible fourth wave, hence the need to put in place preventive measures to contain the upsurge. So let's bring you the figures now as we have them on your screens now from the database of the Ghana Health Service, indicating that a total of some 141 new cases have been confirmed, taking our total case count, as you see there, active cases to some 1,064 cases. In all, 164,000 cases have been confirmed across the country. 1,445 persons dying as a result of the COVID-19 infections. And so far, we've had 160,823 persons recovering from the COVID-19 virus. But if you look at the regional distribution, obviously, Greater Accra remains the hotspot of the virus. And there are some experts who are raising concerns that obviously this situation may be taking us to another wave of the virus. Fortunately, we've been joined by Dr. Michael Owusu, who's with the Nuguch, who's a virologist and an expert in this matter. He understands a lot of the figures and what the trend actually means for the country. Thank you so much, Doc, for your time. So first of all, what do these figures mean? 1,063, 64 cases. Are we safe as we speak?
Yeah, good afternoon to you, and good afternoon to all your viewers. So, I mean, to say we are safe is something we have to weigh as a country to really tell how far we want to go with this particular pandemic. But the numbers you see clearly shows that we are now beginning another wave. I think more of a fifth wave that starts just like many other waves have started. And for those of us who have been studying this trend of the virus, as we always mention, that every wave is driven by new variants. So, I mean, the last time we had Omicron, but this Omicron has about 5 sublineages. And the sublineage 3, 4, and 5 seem to be accounting for a lot of the waves across the world. And in Ghana already, I mean, there has been records of the B4, B5 variants in circulation. So I'm not too surprised that we are likely to get into a full-blown fifth wave. And this is also could be contributed by already the relaxed conditions and the mask that is not being worn as we used to do earlier. And, the social distancing and the need for people to be more careful with how they handle themselves. So once you have these behaviors already not being adhered to, then, of course, if you have a new variant coming, it will just it will not take much time. It will just have to run through the population and then account for the numbers that we are seeing.
Interesting dynamics you're pointing to us there. But if we could just take you back to the live map that we have from the Ghana Health Service so we can look at the regional breakdown. Clearly, the Greater Accra region appears to be leading that chart with some a huge proportion of the cases that we have, followed by the Ashanti region. Why is it so difficult containing the cases here in the national capital?
Well, it's to be expected. And I'm not too sure if we can control it. If you have studied from the first wave till now, almost every wave starts from Greater Accra, goes to Ashanti. If you come to Ashanti, there are particular spots which has accounted for the waves. And if you go through the list, you will find them. Similarly in Greater Accra, the same places that accounted for the first, second, third wave are the same that I believe are going to account for this one as well. And because we always will say that these are variants that are imported, they mostly don't come from within the country. So once people come in, majority of them come through Accra before they move to other places. A majority actually settle in Accra. So the population of movements in and out of Accra is very high. The turnover is quite huge. So it's expected that if you have new variants coming, Accra will be the point that will first experience this before it will disseminate to other areas. So it is not surprising. It is just following the normal trend we have seen before. And this only tells us that, look, if you have to control this well, then you have to start from hotspots like we have done, vaccinate these hotspots well, ensure that people adhere to the precautionary measures, ensure that the social distance is well adhered to, and ensure that people put on masks, especially in the hotspot zones. And these are clearly mapped out, and we know. And therefore, I think at this time we should be better prepared to ensure we reduce the active transmission even than before, because the data is available, and we know what to do, and should not sit down for this to run through the population like it has done.
I'm interested in finding out your thoughts on this. Some experts are saying because we did not get the vaccination process right, in other words, we gave the first doses, the 6 months period or deadline elapsed, and then we have quite a huge number of people not getting their booster. So possibly that could be accounting for the resurgence in the cases that we're seeing. Is that far-fetched?
Well, I don't fully agree with that. If you study these current variants accounting for this, this is mostly occurring even among vaccinated populations across the world. Countries that have achieved close to 80–90% vaccination coverage are experiencing waves as a result of this new variant. So you cannot really say that it's because we delayed or did not vaccinate, that's why people are having these infections. I mean, what the vaccine does is that, yes, the infections will come in, but then you may not have severe illness or possible death. And this is what is good about this pandemic. If it's about infections, yes, people will have it. But then to suffer to the point of being admitted and dying as a result of COVID is what the vaccine, works best against. And therefore, I think that people should get vaccinated, but the focus must be that you don't get severe disease, you don't die, or you don't become hospitalized because you have taken the vaccine, and not because of infection. So we have to distinguish between these two things and ensure that we put this in the right perspective.
Initially, there was no clear answer for this, but are we clear now as to the scientific reasons for which persons who are fully vaccinated still contract the virus?
Of course, we have known this before, that these viruses are still able to infect and cause some level of disease among those who are vaccinated. But this is mild. So what we are seeing nowadays is mild, especially among vaccinated population. They don't experience severe disease and they are not likely to die. But for those who are unvaccinated, they may have severe form of the same virus strain and are likely to die. And that is what we have to understand. So once we encourage people to vaccinate, they should vaccinate not because they will not be infected. They should vaccinate because even if they are infected, their chances of having severe disease and dying will be drastically reduced. And this is how we have to get the communication to the public.
And I want us to once more take a look at the interactive map from the Ghana Health Service in terms of the distribution by sex. You have more males attracting the COVID virus as compared to the female population. There you have it, 38.1% as compared to a significant 57% in terms of the cases that we've recorded so far. Is it the case that the men are not adhering to the protocols?
Well, as I said, the trend has not changed. You already know that a lot of them, if you have to look at the breakdown of the data, these are young, active men that are interacting and are not likely to adhere to protocols and may be more relaxed and may do things that will obviously expose them to these infections. Unlike our female colleagues who are much careful, likely to adhere, not likely to engage in so many active activities. And we also mentioned before that the virus itself has some level of preference for the male gender because of the way the mechanisms.
That's a really interesting point.
Of course, there are at the cellular level, you could see that females and some level of hormones in women gives them some natural level of protection against being infected and having severe disease. This is known before. This SARS-CoV-2. So we will advise that, if you are a man, you have to be very careful not to engage in things that will overly expose you and to ensure that you are more careful with the way you handle things. So females are more protected, and we know, compared to males. And therefore, the men, we have to ensure that we adhere to the protocols very well.
Interesting points there. Let's talk about government measures now. Initially, we got the target of some 20 million vaccination population target which the government put out there earlier. That target has not been achieved, and we are witnessing what you, the experts, are telling us could be another wave. Is that likely to have an impact on government's target?
Yeah, so this has been a difficulty across. If you have monitored government intervention throughout this pandemic, especially within the first quarter of this year, they've done their best to procure a number of vaccines and to organize a number of vaccine campaigns. But you will see that the public response towards this has not been in an exponential or linear fashion, to put it in a way. I mean, as the vaccines come in, you expect people to respond by taking the vaccine more. So you will be able to cover through the population. But then people are just unwilling, especially when the cases went down previously. They just thought that the COVID was gone. So if COVID is gone, why take a vaccine? And you get to a point where some of the vaccines even got expired. So as we speak now, I know vaccines are available, but then to get people to take the vaccine is the major hurdle we have, because people talk that the virus is no more coming. So we have to continue the public campaign and encourage many people, as many as possible, to still take the vaccine. Like we said, it's not because you'll not be infected, but then you take it because even if you are infected, your chances of having severe disease and dying will be drastically reduced. And this message is what must sink well with people. If you have huge vaccine coverage, you have huge opportunity of protecting the life of your population. You may have high numbers, but then the sickness and the death will go down. And we have to support the government in this direction. I know as government does what to bring the vaccine, we, the public, have to do well to respond in a fashion so that we will be able to cover and protect, especially the vulnerable who are within our population.
It's generally not a good time for us as a nation. We're having to deal with the monkeypox virus as well that we're learning of. I mean, what's accounting for the emergence of this new variant of COVID and then the monkeypox? Is it more about the weather or the times and seasons in which we find ourselves?
Well, it's not just about monkeypox and COVID. You also know that we are having problems with influenza, the H3N2 variant, which is coming through swine. Swine that have these viruses in them getting out into the population. But this raises concern about human interaction with the ecosystem and trying to invade into animals, protective areas, which is what is accounting for a lot of these things that we have. And also population gathering and population interaction and the way we behave. We believe and thought COVID would change our life and enable us to live in a more healthy way and imbibing in the good protocols we have learned. But you have also seen clearly that we have not learned much from COVID. Monkeypox is a zoonotic virus that comes from animals. Bushmeat, interaction, squirrels and rats and all these. They harbor these viruses, and then we interact with them and get into the population. But it's transmitted through body-to-body contact and through respiratory droplets. Yeah. So if people were putting on masks and were sanitizing their hands, this virus will not travel far. It will just be killed along the line. But the same processes and the same behaviors that allowed COVID to thrive is the same processes and mechanisms that is going to allow monkeypox and then influenza to also thrive.
Okay, so it's fair to then, it's fair, I'm sorry, but it's then fair to assume that once we get the COVID-19 protocols right, then we're in safe hands in terms of controlling the monkeypox and other viral infections that may come up.
Exactly. This will work very well because the alcohol sanitizers are able to destroy the monkeypox virus the same way they destroy the SARS-CoV-2 viruses. It works perfectly. So it's the same mechanism. Viruses are viruses, irrespective of the name. So the same preventive protocols work for all of them. So this is why we keep urging the population that we don't drop what we have learned. The good things you have learned, keep up with it and add more. But if you want to reverse the things we have learned and then openly embrace the old lifestyle, then we have stand a risk of having things like monkeypox and other things cause community infection even to the point of becoming pandemic, because human beings are not willing to change.
Right.
So the virus are telling us to change, and we have to respond and ensure that we do what is right.
And one of the known ways by which the virus was controlled at the time when we're peaking was the use of the face mask. It appears that the public has gone past it in terms of adjusting their lifestyle and moving past the use of the nose mask. How do we get the public back into that mood and acceptance for the nose mask or the face mask?
Yes, I think we have to continue the education. people must understand that this is something that we have to live with for a long time. And we should not be in a hurry to get this off and just throw it out and get back to normal. I'm very sure that even after monkeypox, we are likely to have other variants of viruses that may come in that may likely ride through the respiratory portal. So, I mean, covering the nose and mouth, that's a lot. And you could see even case of meningitis has gone down because the bacteria that cause meningitis are also transmitted through respiratory droplets and through respiratory portals. So we need to let people understand that, look, we are not in good times. The entire world is not in good times. And therefore, we need to do what we can to protect our lives. And we must educate the public. And where there is a need for us to step up our interventions, for instance, the government coming in to re-announce that, look, people must do their best. People must put on some of these masks at protected places. In healthcare facilities, it must be mandatory. And this is what we keep announcing. You cannot just move through the facilities and people where people are being taken care of, take off your mask and interact. You only contract the virus and send it back to your house. So we need to look at some of these protocols. And I believe that if we're able to deal with this well, we wouldn't be talking about monkeypox or influenza or cholera or meningitis. We can get these things out of our system if only we are able to implement some of these best practices that we have learned over the years.
Anyway, I thought that would have been the last one, but let's wrap up on the possibilities. Is it possible for an individual to contract COVID at the same time monkeypox? I'm just thinking out loud.
Well, it's possible, very, very possible. I hope that nobody gets to that level, but it's something that cannot be ruled out because, as I said, the monkeypox virus, the primary route of transmission is through body-to-body contact. So when you shake hands, when you kiss, when you hug, when you somebody body, you get it. I mean, you easily contract this. And the same portal, if you inhale respiratory droplet from somebody who also has COVID, you also get COVID. So the SARS-CoV-2 is an RNA virus. The monkeypox is also, a monkeypox virus, a DNA virus. And the two can coexist in the body and have different routes of pathogenesis. And they can cause very damaging effect on somebody who has the two combined. So even monkeypox in advanced state can cause pneumonia and can shut down the lungs. So we have to learn how best to put in some of these protocols to protect our lives. And the public must understand the direction of the Ghana Health Service and must walk along this so that we'll all be safe
anyway,
in this world.
Right. Doc, thanks. That's why you're the expert anyway. I'm grateful for your time.